So good morning, ma'am. So now I'm going to demonstrate the neurologic assessment. So before we proceed to the demonstration, we need to introduce ourselves first to the patient. So good morning, ma'am.
Good morning.
So I am Anjik P. Cuba, and I will be your student nurse for today. So I will be the one who will assess you on assessing your neurologic assessment. So for verification po, ma'am, can you please state your name po?
Anjika po ba?
And when is your birth date po?
June 17, 2003.
So after that is we need to perform a hand hygiene. Then next we're going to provide the patient's privacy. So if the door is open, we're going to close it. And also the window and curtains, if it is open, we're going to close it. So now we're going to collect the subjective data to the patient. So ma'am, I just have some few questions to ask po. I hope po you can cooperate with me. So, do you have headaches po?
Wala po.
Numbness or tingling? Seizure activity?
Wala.
Dizziness, light headaches, or problems with balance or coordination po? Decrease in ability to smell or taste? Ringing in ears?
Wala po.
Change in vision, wala naman pong blurred sa paningin niyo po? Difficulty understanding when people are talking to you? Or when you talk to others? Malinawan po yung pandinig niyo? Okay, difficulty of swallowing? Sa pag
Wala po.
lunok? Loss of bowel or bladder control po? Memory loss po?
None.
Okay. So, during the past po, ma'am, na head injury ka na po ba?
Hindi.
Meningitis? Okay po. Then spinal cord injury po? Stroke? Na-stroke ka na po ba mo?
Hindi.
So, treatment received? May na-receive ka po ba mga treatment na dapat? Po? So, high blood pressure ka? High blood pressure?
Wala. Hindi daw na ako high blood.
Hindi ka po high blood, ma'am?
Normal.
Okay po. Normal naman po yung yung blood pressure niyo po. So, Alzheimer disease?
Wala po.
Epilepsy po? So, brain cancer? Do you have po brain cancer?
Wala.
So, Huntington's chorea?
Wala.
So, sa lifestyle and health practices po, any prescription or non-prescription medications po?
Wala po.
Wala ka naman pong tinitake na medicines everyday?
Wala.
So, do you smoke po?
Hindi.
Okay. So, wearing of seat belts or protective headgear?
Hindi naman po.
Hindi ka po gumagamit nun? Okay. So, daily diet?
Pag nagda-diet ako is nagbabawas ako ng kanin and uminom ng madaming tubig.
Then, healthy fruits, ganun po. Okay po, so exposure to lead, insecticides, pollutants, or chemicals. Lifting of heavy objects, nag-lift ka po ba ng mga may mabibigat na objects?
Hindi naman.
Okay po, so frequent repetitive movements. So functioning, daily activities. So after we collect the subjective data, we're going, if may na-observe kang abnormalities sa patient, if may na-find kang abnormalities, so we're going to diagnose it and formulate a collaborative problems. So now we're going to collect the objective data or the neurologic assessment to the patient. So first, we're going to gather all the equipments that we will be needing. So I have here a cotton ball, yung ipopoke sa gag reflex, a pen light. So let's just pretend that this is a pen light kasi wala naman po akong pen light. A gauze pad, a tuning fork, and the substances that the patient's going to smell. So next, again, is we're going to perform a hand hygiene. Next, we're going to explain the procedure or the purpose of what we are going to do. So ma'am, ang purpose po nito ay para malaman natin if there are neurological disease or injury, and if meron, para maagapan natin agad. So next, we're going to ask the patient to put a gown. So ma'am, can you please put this po? Balik lang po ako saglit after nyo pong masuot.
Okay na po.
So, after that, we're going to assess the level of consciousness of the patient. So, ma'am, ano po yung last nyong vehicle o sinakyan o sasakyan?
Tricycle po.
Ano pong petsa nga nun?
26 po.
Anong
Ay,
month?
5,
Anong
6.
month?
March.
Okay po. So, sino po yung current president?
President Rodrigo Roa Duterte.
After that, we're going to observe the appearance and the behavior of the patient, and also the mood and the feelings and expressions, and also observe the thoughts and the perceptions, then also observe the cognitive abilities. So now is we're going to assess for the cranial nerve to the patient. So first, we're going to assess for the cranial nerve number 1, which it is the olfactory, which it is a sensory, and it is responsible for the smell. So I have here is 2 substances that the patients must smell. So the patient must identify if ano yung naamoy niya, para malaman natin yung sense of smell. So ma'am, can you please close your eyes? Then I'm going to cover one of your nostril po. Then you need po to identify if ano po itong ipapaamoy ko.
Perfume.
Okay po. So, standby lang po. Close mo lang po yung eyes nyo. Then the other one naman po, identify nyo po if ano po yung maaamoy nyo.
Vicks.
Okay. So now you can open your eyes po. So, after that, we're going to assess with the cranial nerve number 2. So it is the optic, which it is a sensory, and it is responsible for the vision. So I'm going to get a handheld card. So using this handheld card, the patient must identify or read if ano po yung nababasa niya sa handheld card. So ma'am, I'm going, can you please identify what is the written number or text in the handheld card?
68953.
So thank you po ma'am. So after that, we're going to assess for the visual field, which it is the object can be seen at if focused on the eye at a central point. So ma'am, I'm going to hold my finger po like this. So I want you to look straight at my eye. Then after that, you're going to spot on the wall. So can you please look straight in my finger po? Straight lang po. Then spot on the wall. So thank you. So after that, we're going to assess for the cranial nerve 3, 4, and 6, which it is the oculomotor, the trochlear, and the abducens, which it is a sensory, and also a motor, which it is responsible for the eye movement and the vision. So, ma'am, can you please look straight in my eye po? Then, we're going to check for the upper eyelids. Then, the pupil, if it is round, symmetric, it is round and equal in size. Then, after that, we're going to assess for the cardinal field, which is we're going to put my finger here and I'm going to hold it, and the patients must see this. Dapat sundan nyo lang to without moving her neck and head. So ma'am, I want you po to look at my finger straight po without moving your head and neck. Okay. Now as we're going to assess for the cranial nerve number 5, which is the trigeminal, a sensory and also a motor, which it is responsible for the mastication and the facial sensation. So we're going to assess for the pain and the light touch. So I'm going to get a cotton swab stick. So ma'am, tell me po if ano po yung nafe-pain nyo.
Sharp. Dull. Sharp.
So after that is we're going to assess for the touch or the light touch. So I'm going to get a cotton ball. So ma'am, can you please tell me whenever you feel the object po ma'am that I'm going to naipapafeel ko po sa inyo?
Yes. No. Yes. 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 Yes.
So after that is we're going to assess for the cranial nerve number 7, which it is a facial nerve, which it is responsible for the facial movement. So ma'am, I want you po to perform some facial expressions po. Can you please smile po? Can you please pop off your cheek? Then can you please close your eyes po? Yung di ko po mabuksan. So next, after we assess the patient's facial movement, so next we're going to assess for the cranial nerve number 8, which it is the vestibulocochlear. It is a sensory, which it is responsible for the hearing. So ma'am, I'm going to whisper something. Can you then you will repeat it after me po. So I'm going to cover one of your ear, then I'm going to whisper something, then can you please repeat it after me po.
One.
Then the other ear naman.
Beautiful.
Then after that, I'm going to get a tuning fork, then I'm going to place it to the patient's head. Come on, can you hear that sounds po?
Yes.
Both ears po? So next, we're going to assess for the cranial nerve number 9 and 10, which it is the glossopharyngeal and the vagus. So, I'm going to ask the patient to say ah. So can you please say ah, ma'am?
Ah.
So using a pen light, so we're going to check for the uvula of the patient if it is in the midline. Then the hard and soft palate. Then using this one, yung pang-poke, because I don't have anything na pang-poke, so I'm going to poke the throat of the patient for the gag reflex. So ma'am, I'm going to put this on your mouth, then ipopoke ko po yung throat nyo. Isa pa po ma'am. Then after we assess the cranial nerve number 8, 9, and 10 now is we're going to assess for the cranial nerve number 11, which it is the accessory, a motor, that is responsible for the trapezius in the sternocleidomastoid muscle, which it is responsible for the movement of the head and neck. So ma'am, I want to can you please shrug your shoulder po? Hold lang po ma'am. To check for any contraction for the balance of both shoulder. Then down po ma'am. So I want you po to move your head with my hand po. For the contraction of the sternocleidomastoid muscle. So after assessing the cranial nerve number 11, we're going to assess for the cranial nerve number 12, which it is the hypoglossal, both sensory and motor, which it is responsible for the movement or muscle of the tongue. So we're going to ask the patient to say ah. Can you please say ma'am?
Ah.
So using a gauze pad, we're going to palpate the tongue of the patient. Ma'am, can you please labas niyo po yung dila niyo? So we're going to palpate the tongue of the patient. If there are tenderness, then we're going to get the pen light. Say ma'am.
Ah.
So we're going to check if it is in the symmetry and also in the midline of the uvula. So also check for any abnormalities or changes of color. There are tenderness, swelling, and also the bleeding. So you can close your mouth na po, no? So now we are done with assessing of the 12 cranial nerve. Next, we're going to document all the data that we gather. If ano yung ating ginawa. Then, if you observe or find any abnormalities, we're going to diagnose. So now we are done with the cranial nerve. So now we're going to assess the patient with the motor and cerebellar system, sensor systems, and the reflexes. So first, we're going to assess the patient with the test condition and movement of muscles. So ma'am, can you please do this po? So we're going to test the patient's muscle. Straight lang po ma'am, sa kabila naman po. Then, you can put it down na po ma'am. So, we're going to align finger to finger for the testing of the movements of muscle. So, straight nyo po ma'am yung kamay nyo. Yung kabila naman po. Okay. So, next, we're going to test for the balance. So, ma'am, can you please stand po? So, can you please walk slowly? So, check or assess the balance. Okay na po, ma'am. So, next, after that, we're going to assess for the sensory system. So, we're going to test the light, the pain, touch, and the temperature. So, ma'am, can you please sit po? So, we're going to assess the fine touch. So, using a cotton ball, so we're going to assess the patient with the fine touch. So, ma'am, can you please tell me po whenever you feel the object that I'm going to, na ipapafeel ko po sa'yo?
Yes. Yes. No. Yes. No. Yes. Yes. Yes.
Okay. So, after that, we're going to assess the patient with the pain sensation. So, using this cotton swab stick, so we're going to assess the patient with the pain sensation. So ma'am, can you please tell me po, whenever you feel, if ano po yung nafe-feel nyo whenever I test your pain sensation.
Sharp. Sharp. Dull. Dull. Sharp. 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 Dull.
So after that, we're going to assess the patient with the temperatures. So using a hot and cold water. So ma'am, I want you po to identify these two objects, which is the bottle na ipapafeel ko po, ipapahawak ko po sa inyo. So ma'am, can you please hold this one?
Hot.
So ito naman po sa kabila.
Cold.
So after that, we're going to test for the vibratory sensation. So using a vibratory equipment, so let's just pretend that this is the equipment that we will be using in the vibratory sensation. So wala naman po akong ganung equipment. So now we're going to proceed to the vibratory sensation. Ma'am, can I please have your feet? So we're going to now assess the vibratory sensation. Do you feel ma'am any vibratory?
Yeah.
Vibration, I mean?
Yes.
Yes po. Sa back po.
Yes.
Yes. So after that is we're going to assess the patient with the test position or the position sensation. So ma'am, can I please have your feet? So ma'am, we're going to determine if ano po yung direction na ginagawa ko.
Downward. Upward. Upward. Downward. Midline. Upward. Midline. Upward. Ay, downward.
Okay. So after that, we're going to test the tactile discrimination to the patient. So using a cotton ball, so we're going to assess the tactile discrimination to the patient. So fine touch. So tell me ma'am, if so using these two objects, the cotton swab stick and the cotton ball, so can you please ma'am determine if ano po yung pinaka-feel ko po sa inyo. So can you please close your eyes ma'am?
Dull. Soft. Sharp. Dull. Sharp.
Okay po. So after we assess the patient with the sensory system, so now we're going to the assessing of the reflexes. So we're going to test the tendon reflexes like the biceps, the triceps, the patellar, the Achilles, and the brachioradial reflexes. So using this reflex hammer, so let's just pretend that this is a reflex hammer because I don't have a reflex hammer. So we're going first to assess for the biceps reflex, which it is the test for the spinal cord C5 and C6. So ma'am, can I have your biceps po? Yung kabila naman po. Next, we're going to assess for the triceps reflexes, which it is the test for the spinal cord C7 and C8. So ma'am, can you po do this like this? Ang gabayan naman po. So after that, we're going to assess the patient reflex, which it is the brachioradial reflex. So ma'am, can you do your hand like this po? Okay po, steady lang po. Ang gabayan naman po. So after that, we're going to test the patient's patellar reflex. Naman, steady lang po. Mabila naman po. Then the Achilles. Then we're going to test for the superficial reflexes like plantar, abdominal, and the restimatic. Okay, so we're going to check for the plantar. So now we are done with the testing or the testing of the reflexes to the patient. So we need also to test for any meningeal or irritation or inflammation with the Brudinski and the with the Kerning signal if indicated. So now we are done with the collecting of the neurologic assessment of the motor and cerebellar system, the sensory system, and the reflexes. So after that, we need to document all the data that we gather. And also, again, if we find abnormal findings, we need to diagnose. So after that, after care, we need to gather all the equipment that we've used. Then that's all.